So Albert, who does this new online tool help, and why was it needed?
Well, it's specifically for LGBTQ2 Canadians who are navigating healthcare in Canada, and it focuses around healthcare rights that people may not be aware of if they are sort of engaging with the healthcare system or with any system like a community clinic. And because, addressing LGBTQ issues is sort of, there's gaps, with systems or organizations and institutions, that Canadian Virtual Hospice worked on these 3 resources that are accessible online so that, LGBTQ people would have access to the information that in one place, as well as a couple guides that sort of can help the person, the individual or the family, identify their needs, whether it's end of life or general care in a healthcare institution as well. So it really is filling a gap in terms of healthcare, not just for LGBTQ2 people, but also allies or for healthcare providers to, increase their knowledge about providing appropriate and good care.
There's a part of this online toolkit, My Choices for Safe and Inclusive Healthcare, that component of this site. This is specific to people's personal health information related to their health and their preferences. Is that right? Can you explain us a little bit how that works?
Well, because there's a lot of new information we have just in terms of people's use of gender pronouns, gender identity, or being in same-sex marriage, sometimes service providers don't know the depth of knowledge that really is required to provide appropriate care. So they are sort of tools that an individual can use, or else, a care provider can use to have a conversation with, someone in care, to determine what their best wishes are. Because sometimes, your birth family may not be the best one that's going to come and visit you in a hospital situation. So it's really teasing out and identifying those kind of details. How do you want to be, addressed? What clothes do you want to wear? Those kind of things. So it's specifically around that, and it's very, in plain language, easily read. And again, it's to inform LGBTQ people about the opportunities they have to access proper care or, appropriate care, as well as to not experience any discrimination or have their rights violated in these healthcare situations. And
like you said, too, is for healthcare providers, they should also check it out, kind of get up to speed on what's expected of them. Where do we find this online, Albert?
Yeah, it's on the Virtual Hospice website, the 2SLGBTQ media. That's, if you go there, you'll find the resources there. And there's some videos that are also helpful in terms of listening to 2SLGBTQ people talk about their experiences with the healthcare system. And as well, we know Indigenous people experience, discrimination in healthcare facilities. So for Two-Spirit Indigenous people, it's definitely an important resource that we will need in terms of navigating the systems.
Absolutely. Well, thank you so much, Albert, and you enjoy the rest of your Monday.
Thank you.